Good morning, everyone. Welcome to today's learning session on expanding Medicaid. My name is Avenel Joseph, and I am Vice President of Policy at the Robert Wood Johnson Foundation, the nation's largest philanthropy dedicated solely to health. The foundation has been active for 50 years and is a trusted and nonpartisan source of information on policy that enhances health and the effectiveness of the healthcare system. At RWJF, we are focused on ensuring all people in America have access to affordable and comprehensive health insurance. We know from research that having healthcare coverage saves lives, reduces healthcare costs, and helps people make progress towards eliminating the racial and ethnic health disparities that have persisted for generations. At an earlier briefing on Medicaid, we received several questions about Medicaid expansion: what it is, who it impacts, and what it means. We're here today to answer those questions. This conversation will take a deep dive into the research behind Medicaid, its value, and how expanding Medicaid could improve health and healthcare for millions. Obviously, Medicaid provides people with access to the care they need at critical points in their lives. The COVID-19 pandemic, however, has revealed and magnified a significant coverage problem across the country, as cost barriers continue to prohibit many, especially people of color or those in low-wage jobs, from getting covered and receiving needed care. Medicaid, which covers 1 in 5 people in the United States, is a vital option for improving the health of our communities. I want to stress that we will not be discussing any specific pending or proposed legislation today, but are happy to share information and principles that we believe are important. With that, I'm pleased to introduce Heather Howard, Professor of the Practice and Director of State Health and Value Strategies, which is located at Princeton University. SHVS, as it's called, is a program of the Robert Wood Johnson Foundation focused on providing nonpartisan assistance to states working on transforming their healthcare systems to be more affordable, equitable, and innovative. SHVS provides timely and meaningful technical assistance to all states seeking to leverage the Medicaid program to meet the unique needs of their state residents. With that, Heather, the floor is yours.
Thank you, Avenel. I'm delighted to be here, and it's so great to see such interest among congressional staff in the Medicaid program. If we can go to the next slide. Today's agenda, and hopefully, there we go. Good. Today's agenda, we're gonna start with Medicaid the Basics, which I know many of you know, but I think it's important to ground our conversation, and then talk about what the research is showing on where we are on Medicaid expansion and what we're seeing in the states that have expanded, and then what we're seeing in the places that have not expanded, and really what the research shows about the connection between Medicaid and health equity. And I should start by thanking the Robert Wood Johnson Foundation for, as Avenel said, 50 years of working to expand coverage for people and to advance health equity. And so we want to ground today's conversation in how the Medicaid program, it's not just a vital part of our healthcare safety net, but it can play an important role in promoting health equity. So if we can go to our next slide, I always start when I teach about Medicaid by reminding people about the difference between these two programs, because I know there's often a lot of confusion. So Medicaid, the program we're talking about today, is a joint federal state program that provides health coverage for lower income Americans and individuals with disabilities. Medicare is the federal program providing healthcare for seniors. So we know you hear a lot about both, but just important to remember that Medicare is for people older than 65, and Medicaid is that program for low-income Americans and individuals with disabilities. And one key design difference is the fact that Medicare is purely a federal program, whereas Medicaid is a joint federal state program. So you've got federal rules governing the program, often setting minimum requirements, but you've got significant state variation. So your state Medicaid program is going to look different than even a neighboring state's Medicaid program, which of course researchers love to think about those differences, but it adds a new complication. And so you always need to think about, how is Medicaid playing out in my state? So if we go to the next slide, just another grounding slide on what do we know about the Medicaid program? Well, it's gotten even more important in terms of the coverage landscape. It covers at least 1 in 5 Americans. And actually that number, it's approaching 1 in 4 Americans, because during the pandemic, it's been a really important safety net to people who've lost their health insurance coverage from their provider. In every single state, it's the single largest source of insurance at the state level. And nationally, it's second only to employer-sponsored insurance in terms of coverage for individuals and their families. And because it's that single largest insurer in every state, it's really a critical engine in state economies. And it's also a significant item in state budgets. And so I'm sure when you hear from state officials in your state, you hear about the importance of Medicaid, because it's often the first or second largest state item in state budgets. And it's usually the largest source of state revenue, source of federal funding coming into state budgets. So really important to the people of your states, but also to your budgets. And what do we know about spending on Medicaid? Medicaid represents 1 out of every $6 spent on healthcare. So you see, and it's actually a very efficient program. It's covering 1 in 5 Americans, but only spending 1 out of every $6 on healthcare. It's that third largest mandatory spending program in federal budgets. So when you're talking about federal budgets, inevitably the Medicaid program is coming up. And as mentioned here, on average for state fiscal year 2019, which is the last year for which we have good data, it's just under 30% of state budgets were spent on Medicaid. And to go back, as we mentioned on the previous slide, that varies by state. So that's an average. So in your state, it may be above 30%. In another state, it might be slightly lower in the 20s, but the average is close to 30% of state budgets are spent on Medicaid. So it's critical to federal policy discussions and state policy discussions. Let's go to the next slide. So as I mentioned, Medicare is that federal program, uniformity across the states, but Medicaid, being a joint federal state program, meant that before the Affordable Care Act in 2010, eligibility limits for adults on Medicaid varied significantly across the state. So you might have eligibility levels in one state look very different than eligibility levels in another state for those for adults. There was more commonality for kids and pregnant women, but for adults and also for parents, you had great variation among the states. So the ACA recognized that these gaps meant that you had disparities among the states, and you had people who might be low-income people, working people who weren't qualifying for Medicaid coverage and then didn't have access to health care. So the Affordable Care Act, enacted in 2010, attempted to fill in those gaps and to create a national standard of coverage for low-income people. And it set that standard at 138% of the federal poverty level. You actually sometimes hear 133%, but there's a 5% income disregard. So effectively it's 138%. But I say the 133 because you might see that too and wonder why there's two different numbers. So what does that mean? That's $17,774 for an individual and $30,305 for a family of 3. So this was that's according to current federal poverty levels. The federal poverty level updates every year. So it's always these, you're always going to see numbers. It's never an even number because nothing's ever easy, right? But so this was it. If we can take a time machine back to 2010, the Affordable Care Act was about filling in those gaps and saying we're going to have standard coverage for low-income people across the country. And Congress recognized that states, this being a joint federal state program, that states are footing the bill for this program, paying between 50 and 77%, 50 and down to 23% of the funding. Congress recognized that states have budget constraints. So Congress provided additional federal matching funds for this expansion population to help the spending. And they would have, as originally envisioned, Congress provided 100% funding for this, for the expansion population, and then envisioned after 3 years, scaling down to 90%. So very generous federal match for expansion, 90% funding for every state expanding Medicaid. But of course, that's not the end of the story and why we're here today. There's been several cases that have gone to the Supreme Court, as we know, regarding the Affordable Care Act. The first big one, NFIB versus Sebelius, the Supreme Court found in 2012 that expansion could not be required of the states. So they effectively made Medicaid expansion optional for the states. So if you go to the next slide, where we've ended up with is that not all states have expanded Medicaid. If you think I think this graphic, and thank you to the Kaiser Family Foundation, it helps you envision this. Pre-ACA, the umbrella didn't cover everybody who was low income under poverty levels. And so the ACA, if you go to the middle of the slide, filled in those gaps. And those gaps were especially prevalent for parents and adults without kids, childless adults, we often call them, up to 138% of the poverty level. It was this attempt to nationalize and address these disparities among the states that had, as I'm going to be getting to, real health equity implications. But the Supreme Court in 2012 making Medicaid expansion optional has resulted in not all states expanding Medicaid. And now we have, as you see, this eligibility gap in non-expansion states. So if you can zone in right on this the third part of the panel, you'll see that certain populations in poverty are covered. People above 100% of the federal poverty level are eligible for marketplace subsidies, but you've got this gap between and the average across the states that have not expanded Medicaid is 50% of the federal poverty level for parents. So what that's saying, to sort of bring life to that, is if a parent in a family of three makes more than $9,900 in the average state, and again, these are averages, so in some states it's lower, in some states it's higher, if they make more than that amount, they're making too much to qualify for Medicaid, but they're not making enough to qualify for the subsidies in the marketplace. So we've got this very I study and teach policymaking. You wouldn't have designed a policy program that had this kind of a gap, a hole basically in the umbrella for people. But the effect of the Supreme Court making Medicaid expansion optional means we have this state variation now. So if we go to the next slide, I'll show you where the state variation is. Now we have 39 states, including DC, have expanded Medicaid and have filled out that umbrella, and means that everyone under 138% of the poverty level has health insurance coverage, but 12 states have not. And since Avenel and I last spoke to you in the spring, 2 states have filled in. And it's exciting to be able to, as we were updating these slides, to be able to fill in Oklahoma and Missouri. Both expanded Medicaid this year. Oklahoma, I was just checking, is over 180,000 people are now enrolled in Medicaid as a result of Medicaid expansion. And Missouri's coverage is going live yesterday or today. So really exciting to be able to report the 2 latest states that have expanded Medicaid. And so that's exciting, but we still have 12 states that have not adopted. And what I want to talk about now is what's the impact of expanding Medicaid or of not expanding. So if we can go to the next slide. And of course, as a reminder, these slides will be made available to you, and they have hyperlinks, and we're going to give you links to a lot of the research if you want to dig deeper. And we're available, of course, if you have questions. But what do we know about, what does the research show us about the impact of Medicaid expansion? We know that states that have expanded Medicaid are seeing higher rates of health insurance coverage. And as Avenel reminded us at the beginning, the research very clearly shows that health insurance coverage improves people's health. It's very clear. And so we're seeing higher rates of health insurance coverage in the states that have expanded Medicaid. We're seeing improved health outcomes. So for example, we're seeing people are getting better access earlier to screenings. And some states have done a really great example. I want to call out Louisiana. They have a dashboard that tracks the number of preventive screenings that people in Medicaid expansion have received. And it's really exciting to see, how many people are getting access to colonoscopies, to mammograms, to different screenings because of Medicaid expansion. We're seeing lower incidence of maternal mortality and premature death. And we know, for example, that our country, and we know that many in Congress are focused on the maternal mortality crisis. Well, Medicaid expansion is one key tool to addressing maternal mortality, because the states that have expanded Medicaid are seeing lower rates of maternal mortality. We're seeing, what else does the research show us? Well, stronger healthcare systems. And I want to highlight especially rural hospitals, that we've got a crisis across the country in rural hospitals, but rural hospitals have been stronger and less likely to close in states that have expanded Medicaid. So a real connection there to stronger healthcare systems. And that's been especially true during the pandemic, where you've had healthier healthcare system in rural hospitals, and they've been more able to withstand the stress that the pandemic, of course, has brought. And finally, another key indicator that we track is increased economic activity. And that means more jobs created, lower rates of personal bankruptcy, and all of that, of course, leads to stronger communities in states that have expanded Medicaid. So that's the good news about Medicaid expansion. Let's also talk, if we can go to the next slide, about Medicaid and health equity. More than half now, as I mentioned, the Medicaid program, the number of enrollees has grown during the pandemic because it's been a vital lifeline for people who've lost their employer-sponsored insurance as unemployment has gone up. So we're now at more than 82 million people are enrolled in the program, and more than half of those enrollees identify as Black, Latino, Asian American, Indigenous, or Alaskan Native. So more than half of the enrollees in Medicaid are people of color. So it plays a really important role in addressing racial inequalities in health. And here are some examples. As we know, COVID-19 has, and as Avenel mentioned, has disproportionately affected communities of color, and has shown a light on the cruelty of our health inequities, and really exacerbated this. So Medicaid has been well positioned to provide coverage to those communities as they've been disproportionately affected by COVID. We also know that women of color experience greater risks of maternal mortality, morbidity, and are at higher risk of preterm birth or low infant birth weight. And so the news that Medicaid expansion is addressing these maternal mortality and infant mortality risks is really exciting for researchers who've been studying the maternal mortality crisis. And we're seeing that unfortunately, the flip side is that nearly 60% of those who are ineligible for Medicaid in those non-expansion states, in those 12 states that have not expanded, are people of color, meaning they're not benefiting from this expansion of coverage that's leading to better maternal and child health outcomes. So Medicaid is both a really critical tool for health equity, but it's showing the risks, the risks in not expanding Medicaid are exacerbating these health inequities. If I can go to the next slide, I think we're gonna tease this out more. As I noted, 12 states have not expanded Medicaid, and the research shows that means more than that. The estimates are 2.2 million people are without access to quality, affordable coverage. They would be accessing coverage if their state expanded Medicaid. And this is I think a helpful graphic from the Robert Wood Johnson Foundation, looking at who those people are who are not accessing coverage because their state has not expanded Medicaid. So let's look at the first line is uninsured American adults who are not covered and who would be eligible. And 28% of them are Black, 28% Latinx, 4% other, which that other we know is American Indian, Alaskan Native, or Asian or Pacific Islander, and then 40% white. So real significant health disparities in the majority of people not being covered in the Medicaid gap are people of color. And I think we have to put a pin in this, is that these are people who are really vulnerable, have higher health disparities, and would stand to benefit by Medicaid expansion. If we can go to the next slide, many of these people are nearly 2/3 of the people who are eligible for Medicaid in these non-expansion states are workers or have somebody in their family who is working. So not only is Medicaid expansion helping to address health disparities and promoting health equity, it's supporting workers in our local economies. So let's look on the left here. This is the status of adults in the coverage gap. 64% of them are in a family. So 2/3 of them have a worker in their family, and about half of them are themselves working. So they're working, but their employer is not providing health insurance. And we've pulled out here, you're seeing often they tend to be in industries that tend not to provide health insurance. So it's recreational, often, I mean, the health and social services. So, we're talking about people providing healthcare services, but lacking health insurance themselves. And many, of course, are in retail too, we know. And if we go to the right, a reminder that more than 500,000, so we've got 2.2 million, but a quarter of them are essential workers, are working in industries that we're relying on, that are providing really important services during the pandemic. Now, if we go to the next slide, just a reminder that Congress earlier this year did enact the American Rescue Plan, which did affect Medicaid. And it's important to sort of remind ourselves. The next slide. Because you may be wondering, why are we talking, where does this all fit into what we've done this year? And Heather's talking about there's all these state level variation. What's Congress doing? Well, to sort of remind ourselves that the Affordable Care Act, that the American Rescue Plan did provide additional subsidies for those people above 100% of poverty who are purchasing coverage on the ACA. It also significantly strengthened the Medicaid, and I think we're already starting, and certainly we're starting to research the impact here, but starting to see the benefits of this as it increased funding for home and community-based services to help seniors and people with disabilities stay at their home. And that's been really important during the pandemic, keeping people in their homes so they're not in congregate settings where they're at greater risk of COVID. I'm really excited about the American Rescue Plan option for states to provide coverage for postpartum women for 12 months after their pregnancy. Current law is only 60 days. And the American Rescue Plan made it easier for states to provide this option. That will start next spring, but states are already getting ready to take advantage of that. Also, the American Rescue Plan strengthened Medicaid by creating an option for states to cover mobile crisis intervention services that will help people avoid hospitalization and incarceration. That will go into effect next spring, and I think I'm seeing great state interest in this. And finally, most relevant to this discussion is that the American Rescue Plan provided an additional financial incentive to states to expand Medicaid, increase the federal FMAP, the federal Medicaid match for states that expand Medicaid, to make it to create an even stronger financial incentive for states to expand Medicaid. And we're going to be able to see Oklahoma and Missouri are going to qualify for that. So we'll see they're going to get additional funding, which is going to help their fiscal situation. But they're the two states that have expanded this year. We still have those 12 states that haven't, and even in the face of these incentives. So let's go to the next slide. I wanted sort of, as we bring it home, to remind you of what does the evidence show us about expanding Medicaid and how it would promote health equity. We know that it is immediately reducing racial inequities. In the first 5 years of expansion, we saw uninsured rates and the differential between whites and African Americans decreased by 50% in expansion states, and at a lesser rate in non-expansion states. So that gap that we had of insurance rates between white and Black adults narrowed at a greater rate in expansion states than non-expansion states. We know that Medicaid expansion is reducing mortality rates and improving quality of life. So it's, for one example, is it's associated with reductions in end-stage renal disease mortality, as well as maternal mortality among Blacks. So we're thinking about it from, it reduced coverage gaps, but it's also having real impact in quality of life and especially maternal mortality, which we know is a focus for members of Congress. We know it's increased access to coverage. Individuals at high risk of severe COVID in non-expansion states are more likely to have inadequate insurance than those in expansion states. So I really worry that even as we've made things like the vaccine and testing free for people, if people don't have health insurance, they're less likely to be accessing their their healthcare provider. They're less likely to have a usual source of care, a medical home. And those that are higher risk of COVID may not be accessing the healthcare system. And that is really scary. And then finally, it's strengthening the safety net. We know that Medicaid expansion contributes positively to the financial viability of rural hospitals, so the healthcare safety net is stronger. And one example of that is that rural hospitals in expansion states are 62% less likely to close than those in non-expansion states. So we're seeing a rural hospital crisis across the country, and one key a tool that states have to support their rural hospitals is Medicaid expansion. And we've seen that play out, that rural hospitals are less likely to close in expansion states. So I think we can go to the final slide, where we wanted to give you resources as you learn more about Medicaid. And these will be hyperlinked and they'll be sending around afterwards, so you don't need to worry about getting them now. But I want to point your, and they're all really interesting for, if you want to learn more, but I particularly want to draw your attention to That's Medicaid and Medicaid Covers Us at the bottom, because That's Medicaid has compiled real stories of people who've been helped by the program, and they've done that for all 50 states. So if you click on, you can find stories from your state. And I think it's really helpful for you to be able to learn and see how this is playing out in your state. We're talking about some of this at a very high level, but these are real human beings living in neighbors and family members in your states. And I think it would be very interesting for you all to be able to link through to see some of these stories and learn more about the people in your state who Medicaid is helping and your work is helping. I think that's our last one. And now we get to move to questions. Avenel, I'm going to send it back to you.
Thank you so much, Heather. That was really such a treat. The Medicaid program is such an important federal-state partnership, and it's so energizing to have you here, someone so immersed in this program, and right there at that intersection to teach us more about this vital program. So now we're going to move to questions. We'll take questions from the audience. If you want to ask a question, doesn't matter how silly you might think that question is, that's why we are here. Please click the raise my hand button at the bottom of your screen. For those who are joining by phone, you can select *9 and we'll call on you in the same way. I'm really struck by your presentation, Heather, and in particular, want to highlight two things. One is that I was spending some time on the That's Medicaid page recently, and the diversity of stories that come through of people who have had Medicaid really be a lifesaver for them is not only touching, but really just shows the breadth of the program and how important it is for lots of different aspects. One of the things we didn't cover in terms of outcomes and services provided by Medicaid, and that I know Congress has been paying a lot of attention to, is the substance abuse crisis and mental health services. And wonder if you could just, say a sentence or two about what Medicaid does in that space.
Yes, I mean, Medicaid is usually in most states the largest provider of substance use treatment. And so as states have been grappling with the opioid crisis, and we know that crisis has not abated during the pandemic. And when people ask me, what issues are states going to get back to when the pandemic's over? My first one is the opioid crisis and substance abuse, right? So Medicaid is the largest payer of these services. And so getting people into coverage means getting people into treatment. And Medicaid has been rather nimble, I think, during the pandemic in pivoting to telehealth and finding ways to help people even during the pandemic through providing services through telehealth if necessary. And actually there's been, I think it surprised a lot of us researchers, in particular in the behavioral health space, right? We had always thought that maybe telehealth wouldn't be a right match for behavioral health, but actually it has been really helpful, I think, getting people, because there's been this concern that one of the reasons the opioid crisis has actually worsened has been the isolation of the pandemic has exacerbated. So to be able to provide behavioral health services by telehealth, as states have responded to relax their rules on telehealth, and to be able to provide mental health services has been really important. But also actual treatment and providing access to buprenorphine and to residential treatments. We've seen a number of states get waivers to be able to provide inpatient treatment. States like New Jersey have done really interesting. New Jersey decommissioned a prison that they were no longer using, and created more inpatient beds, and then increased reimbursement rates so that more providers would see patients. So that was the state in tandem with Medicaid was the scaffolding on that made all of this possible, because the state had expanded Medicaid, and most of the people who needed treatment were in the Medicaid population. So when states that have not expanded are leaving a really important tool out of their tool belt by not expanding Medicaid.
Yeah, thank you for that, Heather. The other thing that really struck me is that graphic that you presented from the Kaiser Family Foundation. And I really appreciate the way that you walked through it, because it can be complicated to follow those sorts of graphics. But in particular, it was just so striking to me that we're talking about a family of three that makes $10,000, less than $10,000 a year. So they're not in a place of employment where they're offered employer-based health insurance. They're not eligible for subsidies to help them buy private health insurance on the marketplace under the Affordable Care Act. And they also are not eligible for getting Medicaid as a part of their state, but they're making $10,000 or less for a family of three. And I'm just like, I'm really struck by that factoid. I think we kind of get lost in the federal poverty level and all of the percentages and what that means for a family. And so that's like a really interesting factoid, but I also thought you could talk just a little bit about the role of Medicaid in boosting the health of the state economy too.
Yeah, I'm glad you brought us back to that, because I think it's worth repeating, and that's $10,000, under $10,000 a year, right? So somebody making $1,000 a month has blown through their eligibility limit. And that's the average. Some states are below that. Some states are slightly higher, right? So we're talking about a family of three that likely has at least one worker in it. So right? I mean, so they're making income and they're working, and they have at least, they have a child, but they're not qualifying. But we've created this system that has just this big hole they've fallen into, that where they're poor. They're by all definitions poor, but they're under the poverty level, but they're making too much to qualify for Medicaid. So and they're working. So it is really, and there's a good chance they're working in an essential job, right? A job that we say we value, right? So I'm glad you brought us back to that. But the fiscal health of the states, I think, let's talk about that. That the research has really shown that Medicaid expansion is good for states' fiscal health. And I should remind folks that states have to balance their budgets every year. So that's one key difference between states and the federal government. States have to balance their budgets every year. So states are every year, and I don't think we even said this at the beginning, but I was New Jersey's Commissioner of Health and Senior Services, so I saw this firsthand. States are every year struggling to balance their budgets and matching their revenues with their expenditures. Medicaid expansion has been a clear fiscal win for states, because it's bringing in, the way Congress designed it, by providing a much higher match rate for Medicaid expansion. It's actually providing fiscal relief that is allowing states to invest in other programs. We've seen states say, I can expand other programs because I now have more funding coming in because of the generous federal match. We're also seeing that there's a reduction, and this goes hand in hand with strengthening the healthcare system, the safety net. There's a reduction in uncompensated care. Previous to the ACA, we have a federal law called EMTALA that says that hospitals can't turn away people who come to emergency rooms. So hospitals provide care, and it's part of their mission, of course, but they're not compensated for it. So what happens then? Well, many states have uncompensated care programs where they reimburse hospitals for uncompensated care. Well, right there, states have been able to reduce their uncompensated care programs and use those funds to invest in health programs or elsewhere. States were using state dollars often to fund, for example, substance use programs. Now Medicaid is covering those programs, and that frees that money up for the states. Also, I think this economic activity point is really worth mentioning. I mean, there was really interesting work done studying expansion in Montana. We know that in most states, healthcare is the first or second largest source of jobs. It's a large industry. In Montana, they saw significant job growth. They were able to quantify job growth because of Medicaid expansion. So it was bringing more money in. More people, people had access to healthcare. It improved their health, but it also created jobs, and they were able to quantify that. Other states have done that too, but I just was most recently looking at, and it was really interesting to see how Montana was able to quantify an increase in jobs because of Medicaid expansion, and of course that has cascading effects for the economy. And finally, I should add too, we've seen reductions in consumer debt. We know that healthcare costs are the largest driver of personal bankruptcy. And in Medicaid expansion states, we've seen reductions in consumer debt and reductions in bankruptcy. And we know that also has a cascading effect in communities if fewer people are having to file bankruptcy because of their healthcare costs.
Yeah, thank you for that, Heather. So we have a couple questions that are coming in from the audience, which is great. We only have a couple minutes left, so we're going to have to do these pretty quickly. And I want to invite people in to ask their question live. So we have a question from Jamie. Jamie, if you could please unmute your line to ask your question.
Hi, thank you. This is Jamie Raspberry. I'm in Mississippi, and just curious if you can share any insight into how other states have been able to make this happen, because you probably know that Mississippi is lagging behind in Medicaid expansion, and we're really working hard to push that forward. So it would be good to know kind of what the strategy was, or if you have any resources that you can share with some other states that were able to make this successful.
I'll start. Thank you. That's great, and it's great to hear that you're thinking about these issues in Mississippi. And right, Mississippi is a non-expansion state, and let me just talk generally about what we've seen. Is that when these debates unfurl in states, what's been helpful is to study what the impact would be. And I don't know the Mississippi example closely right this minute, but what I've seen in other states is then there's been, and the Robert Johnson Foundation has actually been involved in interesting studies looking at what would be the impact, how many people would be covered, what would be the impact on the healthcare system, what would be the impact on the state budget. I think you need to think about all of those ingredients, right? How many people are we talking about being covered, and who would be impacted? What would be the impact on the healthcare system? One thing that I think has been important in states is so you've got the consumers who are being impacted. Those voices are really important to center. It's also really important to think about the healthcare system, and hospitals have been very engaged in many states, thinking about the role that uncompensated care plays, in states, and this may be happening in Mississippi. I know I've been watching North Carolina for a long time, and North Carolina's had a number of rural hospitals closed. So hospitals have been very active in making the case for how the healthcare safety net would be strengthened. And then so there's the centering the voices of people who would be affected, the healthcare safety net, and then the state budget, and looking at, for example, my point about how it's a win for state budgets, doing the analysis of how many people would be covered, what would be the federal match. Now there's this additional federal incentive that many studies have shown more than the money that was in the American Rescue Plan, more than pays the cost of expansion. So it would be actually a win for the taxpayers because of that. So I think it's thinking about all three of those, and there are a lot of resources out there that bring this together.
Thanks, Heather, and thanks, Jamie, for your question. We have another question we're going to try to squeeze in here, Heather, in about the 2 or 3 minutes we have left. This one is from Shahana. Shahana, please unmute your line so you can ask your question.
Thank you. I appreciate all the information you've shared, and you've really certainly made a compelling argument for expansion, which is something that I personally support. My question, though, is what does the opposition say? What are the concerns that they have? Because you've made many compelling arguments related to both the health of constituents as well as the financial rewards to states. So what does the opposition say in the states that don't have expansion? What are the concerns they have about implementing that?
Well, I think, there's always that's a great question. Thank you for that. I think there's always concern at the state level, and I even experienced this as a state official, always concern about expanding programs and worried about their long-term viability, which is why financial viability, which is why these studies are so important, because they show that that expansion is viable long term. One question I always get is, so is Congress going to continue to fund at that 90% match rate? And Congress, from my studies, Congress has never reduced a federal match rate. So I think sometimes it's about answering questions like that. I think the other thing I would point to is the Affordable Care Act. It's very clear. There's research has been, there's been political polarization around the Affordable Care Act, but I take to heart that both Oklahoma and Missouri, which expanded Medicaid this year, did so based on ballot initiatives, and the voters approved expansion. Now, not every state can expand Medicaid by ballot initiative. It depends on the state constitution and whether the voters can put an initiative, a question on the ballot. But to me, I think it's interesting. Those of us who study it see broad support among voters when they're asked about expansion, and broad support for the Medicaid program more generally.
Thank you, Heather, and thank you, Shahana and Jamie, for your live questions and for all this really wonderful information that's been provided, Heather. I think, as we mentioned in the beginning, but I'll say it again, we're going to send a recording of this webinar with links to the resources. Embedded in the resources will be some of this data that Heather just highlighted that shows both the economic long-term viability as well as the health and equity benefits of the Medicaid program and how that's played out in states that have expanded over the last 10 years. Stay tuned for more information about future learning sessions like this one. We're going to send around a brief anonymous survey to you today about this discussion, and we really would appreciate if you could complete it to help us plan for future events. Thank you again to the extraordinary Heather Howard and to all of our attendees who stuck with us for the last 45 minutes or so. Thanks and have a great rest of the day.